I've always really loved being around people, and I've loved science and medicine and helping people, and it just felt like a natural fit for me. Once I got into residency and I started doing more cardiology rotations, I really loved the procedure aspects of it, but also the fact that you get continuity with patients in the outpatient setting as well. So you get to treat them in the hospital, take care of their acute situation, and then you follow them in the outpatient situation, and then at that point can help them with more prevention medicine, help them treat their lifestyle, and really affect how they take care of themselves in the long run. Over the last 3 years in my fellowship, I've really seen that there's really been a turn towards women and heart disease. A lot of the patients that come in, the majority of them are women, and they usually present later in life because a lot of times women seem to put off their symptoms more than men. Women's symptoms are more atypical than men's symptoms. Sometimes it's just fatigue and anxiety. They're more tired than they usually are, but sometimes these are just symptoms that women have in general. They're busy with their household, they're busy with work, they're busy with their children, so they seem to put off their symptoms, and they present later in their disease, which makes it more difficult to treat it in the long run. So I think it's very important to get the word out there that the women's symptoms are different than men in order to help treat that better and help prevent women from having long-term issues with their heart disease. So my passion is really taking care of women and having them be more aware of heart disease. It is, be more aware. There's the new Go Red for Women campaign that's every February now, that's been around for a couple of years. So the word's getting out there that heart disease does affect women just as much as it affects men, if not more. And so I think that it's a very important topic, and that it should be more focused on. I love my job. I love the people that I work with in the hospital. I love the people I work with in the office. Every day is exciting. There's so much to learn every day. Cardiology is very up to date with all the information that we have. There's always new clinical trials. There's always new medications coming out, always new treatments and diagnosis. And I think that kind of keeps everybody learning, constantly learning, because you never want to be behind the 8 ball. And so I just love that there's just so much information all the time, and there's always new things, and it's very exciting. Cardiology is just a very exciting field to be involved in. I'm passionate about prevention. I'm passionate about what I do. Helping patients is very important to me, not just with their medications and their heart disease, but just in general. I feel that I connect with people very well, and I like to hear people's stories. I like to know what they did during their lifetime, even from the 94-year-old that was in the war, or to the young 30-year-old that comes in that wants to talk about college and about her new job. I like to hear people's stories, and I think that helps me connect with them, and also better helps me treat the patient in the long term. One of the advantages of being a female cardiologist is that women feel more comfortable, at least from what I've seen, is that women are more comfortable with a female physician. They're more comfortable asking intimate questions that they may have never asked their male physician that they've had for 20 years. Once we make that connection, they're just more comfortable asking me the questions that they've always wanted to ask, but they just feel maybe even embarrassed to ask that question. So I feel like that is a good connection for me to have with my patients.